Hi, my name is Vanessa. I'm going to be performing trach care on my patient, which includes suctioning and dressing change. I have verified the doctor's orders, so now I can proceed. I will walk to the patient's room. Patient is on standard precautions. Knock, knock, may I come in?
Yes.
Provide some privacy. I'm gonna wash my hands. Hi, my name is Vanessa. I'm going to be your nurse today. How are you doing today?
Good, thank you.
Good. May I ask what your name is?
Mary Jo,
And your date of birth?
6/7/97.
Okay. So the reason why I'm here is because I need to do some trach care, which includes suctioning out any mucus that you can have in your trach. And I'm also going to be changing the dressing change that's around your stoma to prevent an infection. Is it okay for me to proceed?
Yes.
Okay, do you have any allergies?
No, I don't.
No? Okay. So I'm gonna don some clean gloves. And I'm gonna start off by pre-oxygenating my patient. So I am going to boost this up to 15 liters for 15 to 20 seconds. It's been 20 seconds, so I'm gonna put it back down to between 5 and 12 liters. That's what the doctor had ordered. Okay, and then I'm going to do my safety checks. So I'm going to start off with my suction machine here. I'm going to turn it on onto regular, making sure it's between 80 and 120 milliliters of mercury. I'm going to check my suctioning. Looks good. I'm going to check for any kinks or any holes in the line. There's none in the line. And I'm going to check the tubing as well. There's no holes, no kinks. I'm going to check the oxygen humidification here. It is set to 35% and it is between 5 and 12 liters. And then I'm going to check my oxygen, making sure it's between 95 and 100. Okay, looks good. So now I am going to also check my emergency kit, making sure there's an ambu bag and a dilator, and also making sure that there's a tracheostomy, making sure the size correlates with the size that the patient has. Okay, so now I'm going to remove my gloves. I'm gonna wash my hands. And here I have my supply. I have a 14-inch suction catheter kit. I have a tracheostomy cleaning care kit. I have a clothes protector for my patient, which I'm going to place on her to prevent any liquid or mucus to be splattered on her gown. And I also am gonna don some clean gloves. Or no, I'm not gonna don any gloves right now. I'm gonna move this to the side. So I have performed hand hygiene. I'm gonna open up my kit. Toss that in the trash. I'm gonna take out my sterile basin, put it here to the side. I'm gonna pour some normal saline in it. And now I am ready to open up my sterile gloves. And I'm gonna don my hands. Fix my gloves up. Okay, toss this into the trash. So here I have my suction catheter. And my left hand is going to be my sterile hand. My right is going to be my non-sterile. So I'm going to start by connecting. Make sure to maintain sterility. Or I should have not done that. I should have turned it on first, making sure it's between 80 and 120, checking, and then connecting. Okay, so now I'm going to dip the catheter to check the patency and flush the line, making sure it works. And then also I'm moisturizing the tip of the catheter. And then I'm going to lower our mask down. And I'm going to dip the tip into the inner cannula. And I'm going to go about 5 inches or until the patient coughs. And then I'm going to remove 1/2 inch, and then I'm going to start intermittent suctioning, doing it in a circular motion. Okay, and then I'm going to clean the line. Okay. Place her mask back on. I'm going to remove, and then I'm going to turn this off. Okay, I'm going to dispose of my trash, which I have here near bedside. I'm going to remove my gloves. I'm going to wash my hands. Okay, so now I'm going to change your dressing that's around your stoma. Is it okay for me to proceed?
Yes.
Yes. Okay. All right. So now, so I had washed my hands. Now I have my tracheostomy care kit, and I'm going to open it away from me. And I'm going to pinch out my gloves. And I'm going to pinch out my sterile drape. And I'm going to open it by the 1-inch borders, making sure shiny side is down. And then I'm going to dump everything within my 1-inch borders. Okay. And now I'm going to put some normal saline. 1 to clean, 1 to rinse. And then I'm going to don my sterile gloves. So I'm going to pretend there's another table here. So my gloves don't touch at least the 1-inch borders there. I'm gonna don gloves. Okay, pinch that, toss it in the trash. So both of my hands are sterile. I am going to grab my Q-tips and I'm going to moisture them, put it to the side. I'm going to grab one of my gauzes, I'm going to moisture that, put it to the side. Here I have my string, my 2 pipe cleaners to dry the inner cannula, the fenestrated gauze, got a pipe brush, and another gauze to dry the area. So now I am going to remove, so this hand is no longer sterile. I'm going to remove the dressing, the solid one. Toss it in the trash, and I'm going to grab my Q-tip and, okay, I'm not gonna do that. I'm going to remove the inner cannula, making sure to maintain the curvature of the neck. And I'm going to dump it in normal saline, let it soak. And then I'm gonna grab my brush and I'm going to clean it inside and outside. Toss and then rinse it. Dry for excess solution. Now I'm gonna grab my pipe cleaner and dry the inside and then the outside. Gonna put it back in the same curvature of the trach. Okay, so then I've locked the cannula in, and now I'm going to clean the in circular motions one side, toss it into the trash, and then do the underneath the trach, toss on the side, toss on the other side, and then the inner part, and then moisten, and then just do a dab around. And then I'm going to dry the area. And now I'm going to apply my fenestrated drape. Okay, and now I'm gonna leave this string on until I put this new one on her. I'm going to put it through the loop. I'm going to create my V shape, making sure there's no rolls. Put it around her neck. And then I'm going to put it through the loop. And then before I tie it, I'm going to check with 2 fingers, making sure it's not tight. Okay. I'm gonna fasten it. I'm gonna remove the old one. Okay. And put the oxygen back on, and making sure it's between 5 and 12 liters. And now I'm going to toss all of my trash. I'm going to remove my gloves, wash my hands, and then I'm going to remove her clothes protector, toss it into the solid soiled base container, and then give her her call light. And then, do you need anything else before I go?
No, thank you.
No? Okay, so then I leave the room, and I'm going to document the area around the stoma, the amount of liters I increased or decreased, the color, consistency, any odor to the dressing change, the supplies I probably used on her, how the patient tolerated the procedures. And and date, sign the progress note, and that's it.